Hi everyone, Dr. Nemechek here. I want to give you an update on as we're learning more about long COVID, leaky gut, and we'll touch on how it's affecting blood vessels and the heart, in particular in women. So this recent paper is here's sex differences in inflammation and markers of gut integrity. So if you don't have integrity in the gut, you have leaky gut, okay, in long COVID. Now long COVID is defined as symptoms persisting. Some people say 3 months, some people are now saying 6 and 12 months, but basically you get your respiratory problems, you get over those, and you have these other symptoms that just persist. And now I want to talk about leaky gut real briefly. So we have this line here is the barrier in your small intestine, and this is normal. This little thing is supposed to be a bacteria. You don't have any excess bacteria. There's nothing getting through, okay? Now this is SIBO that we use inulin in children or rifaximin for in adults, where these are all excess bacteria here, and that biological stress causes leakage between the cells, what we call paracellular intestinal permeability. Now remember, 70% of your entire immune system's right here. Those cells are going to react to all this stuff leaking through. So that's where you get a huge inflammatory reaction from that, okay? Now, COVID does something completely different. COVID, look at this. This looks really different here. This, behind these little blobs, that's a cell dying, okay? That cell is dying because of a deficiency of glutamine, an amino acid. So the treatment for SIBO is inulin or rifaximin. If you have a COVID leaky gut, the treatment is oral supplementation with glutamine. Now let's go back to the study and see what they showed. So they showed higher levels of inflammation, okay, and gut integrity problems. So if zonulin or the BDG levels are high, that means you have leaky gut, was associated with a twofold increase in having long COVID, okay? And this was 4 times more likely in women. Now, among females with long COVID, they had higher levels of inflammation markers, worse gut integrity, so higher zonulin is more leaky gut, and was associated with higher what's ALX numbers. That's worsened arterial elasticity. When blood pumps through your blood vessels, they need to have this elasticity, like rubber, to expand and retract as that pulse wave goes through. And that helps keeps your blood pressure down and limits the damage that pulse can do. That waveform of blood flowing through can have on the body. Now, if that gets tighter, what they've found is, so here's arterial stiffness. So if it's too stiff in the arteries and your aortic, you can get what's called diastolic dysfunction. This is a form of heart failure, okay? And this is more common in women than men with long COVID. Now, men do worse in the hospital. Women do worse chronically when they aren't in the hospital with COVID, okay? Now, so we're having more heart failure. And remember, this leaky gut that you can get here, you have about a 25% chance of getting this per episode of COVID, and it can last at least 2 years. Okay, it's pretty high. You got to worry about this because you might be developing heart failure slowly just from that leak. Now, what we know, I've talked about glutamine. Here's a paper talking about, and just to cite other sources, accumulating data have discovered that the deficiency of circulating glutamine in patients with COVID-19 is associated with disease severity. Disturbance in glucose metabolism contributes to the development of severe infections, inflammation, oxidative stress, blood vessel spasm, blood clot formation, which can lead to blood clot, blood vessels being plugged, and even multi-organ failure and death. This is driving a lot of the death on the inpatient side. And it is part of the long COVID part on the outpatient side. And so here then is a study looking at giving glutamine to patients with COVID. And so now the dose here, these were inpatients, but it's 10 grams 3 times a day. So it's 33 grams a day. On the outpatient, you can go 15 twice a day, and that's equal to 1 level tablespoon twice a day for adults. Okay? And I suggest you do that at least 6 weeks. But what they found is when they gave them the glutamine, these markers, beta-1 interleukin, TNF factor, and then CRP, where these are all markers of inflammation from leaky gut, were significantly reduced just 5 days, within 5 days. This can heal very fast, okay? You can buy glutamine. I recommend the Now Foods brand. It's very reliable. It's inexpensive. And don't buy the capsules, okay? You need 15 grams twice a day. The largest capsule is 1 gram. So you'd be taking 15 capsules twice a day. You aren't going to do that. That's ridiculous. You need a tablespoon twice a day for 6 weeks, okay? And that will, with a high degree of assurance, will shut off this leaky gut. This long COVID is turning into a serious problem, folks. And this is just one example where it's causing, potentially causing heart failure in women, but there's all sorts of other things that we're understanding can cause, from chronic fatigue to ADD, basically, brain fog. It may be triggering pulmonary cancers, a whole range of very frightening things. And so we've got to take this seriously. You can look, I've got multiple other videos about COVID, about glutamine, about leaky gut. Search in YouTube. There's a bunch of different ways to think and look at this. There's videos about how this is affecting children. And we have, click subscribe so you can stay on top of this. And I'm always going to be feeding you just the latest updates about, this topic and many others. So I guess that's all for today. Take care of yourself. Take care of your children. Keep your inflammation down. Have a good day.